Amniotic fluid, it's a liquid that protects or covers the fetus during pregnancy. Amniotic fluid is a liquid that protects or covers the fetus during pregnancy. The main function is protective function of the fetus. During pregnancy, the amniotic fluid acts as a shock absorber, then maintain even temperature of the fetus and the surroundings. Also helps in the growth and free movement of fetus, and also prevents addition between fetal parts and amniotic sac. So during pregnancy, it acts as a shock absorber, maintains even temperature, then allows the growth and free movement of the fetus, prevents addition between fetal parts and amniotic sac. During labor, the amnion and chorion combine to form a hydrostatic verge which helps in dilation of the cervix. So during labor, it helps in the dilation of cervix. During uterine contraction, it prevents marked interference with the placental circulation. Then the third, it flushes the birth canal at the end of first stage of labor, and by its aseptic and bactericidal action protects the fetus and prevents ascending infection to the uterine cavity. So during labor, it helps in the dilation of cervix, and it prevents the interference with the placental circulation in the contraction, and also it provide a aseptic or bactericidal medium during the time of birth. Also it prevents the infection in the uterine cavity. The physical features of amniotic fluid, it is faintly alkaline, low specific gravity, that is 1.010, and become highly hypotonic to maternal serum at a term pregnancy. So hypotonic when it is at term pregnancy. Then osmolarity of amniotic fluid is 250 milliosmolarity per liter. So osmolarity of the amniotic fluid is 250 milliosmolarity per liter. And the water in the amniotic fluid is completely changed and replaced in every 3 hours. The fetus swallows the amniotic fluid around 200 to 500 ml of liquor every day at time. It is 20 ml around 4 to 8 weeks, 350 ml to 400 ml up to 20 weeks, 700 to 1000 ml 37 weeks, 600 ml to 800 ml 40 weeks. So the amniotic fluid volume, it increases according to the weeks, but after 37 weeks the volume will be decreased. The peak amount of amniotic fluid that will be in 37 weeks 700 to 1000 ml, and after the 37 weeks the amniotic fluid amount will be decreased, and at 40 weeks it is 600 to 800 ml. So it starts from 20 ml, that is 4 to 8 weeks, then 350 ml to 400 ml 20 weeks, then 700 to 1000 ml 37 weeks, then it descends or it is decrease its amount, that is at 40 weeks it is 600 ml to 800 ml. Next one, abnormality in the color of amniotic fluid. So usually the color of the amniotic fluid is colorless and pale straw color. Colorless, otherwise it is pale straw color. That is the normal appearance of amniotic fluid. If the color, amniotic fluid color is green, that indicates fetal distress. If the appearance is green, that means meconium is passed by the child. That's why there will be fetal distress. Then golden color, that indicates RH incompatibility. Then greenish yellow of saffron, that indicates post maturity. Dark colored or blood stained, that indicates abruption or concealed accidental hemorrhage. Then dark brown or tobacco juice, that indicates intrauterine death. Then purulent amniotic fluid, that indicates the chorioamnionitis. So abnormal color of amniotic fluid, green color indicates fetal distress, golden color RH incompatibility, greenish yellow of saffron, that is post maturity, dark colored or blood stained, that indicates abruption or concealed hemorrhage. Then dark brown or tobacco juice color indicates intrauterine death. Then purulent amniotic fluid indicates the chorioamnionitis. Clinical importance of amniotic fluid. The first one, screening of fetal malformation. Serum alpha fetoprotein, that will be assessed during the uh, fetal life, and the amniosynthesis is the test. Here the alpha fetoprotein test helpful to identify the neural tube defect, Down syndrome, etc. So screening of fetal malformation, the amniotic fluid helps. Then assessment of fetal well-being, amniotic fluid index. Amniotic fluid index, in order to assess the excess amniotic fluid or the low amount of amniotic fluid. If the amniotic fluid index greater than 25 centimeter, the amniotic fluid level will be 2000 or exceeds 2000, that indicates polyhydramnios. If the amniotic fluid index is less than 2 centimeter, that means less than 5 centimeter, that means amniotic fluid will be around 200 ml. That is very decreased amount, that is known as the oligohydramnios. So this amniotic fluid, that will helps to assess the fetal well-being of the child. So amniotic fluid index will be calculated by using ultrasonography. Next one, assessment of fetal lung maturity, that is lecithin sphingomyelin ratio. Normally lecithin sphingomyelin ratio will be more than 2. That indicates the fetal function or the lung function is adequate or matured. But if the lecithin sphingomyelin ratio is less than 2, that indicates the respiratory distress syndrome. Then also the diagnosis and follow-up of labor, the amniotic fluid, the rupture of amniotic fluid or the drainage of liquor, that is helpful for the induction of labor. So the diagnosis and follow-up of labor, amniotic fluid is used. So these all are the clinical importance of amniotic fluid.